Well, welcome and thank you so much for joining us for another conversation in the I Am New Orleans Conversation series. And today we're discussing lactation consultants, a labor of love. My name is Taeshaun Walters. I am a certified lactation counselor, also a parent-child educator for Training Grounds, Inc., also known as the We Play Center. I am an aspiring IBCLC, and by the time the summer ends, I will also be a doula. I am a strong maternal child health advocate and self-proclaimed lactivist, and I'm super excited to be your moderator on today. This is an amazing experience, and I'm so happy that everyone was able to join us. So I'm also excited about our panelists today. We have a very diverse group of ladies that's going to help us dig into some disparities that our moms and babies are facing of color, and the key role that lactation consultants will play in their health. There will also be 3 conversations over the year focused on maternal and child health, and all are a part of I Am New Orleans. For those of you who may be unfamiliar with this, I Am New Orleans is a community-led campaign to inspire conversation and action around key issues of racial equity that impact our children. It is being supported by the W.K. Kellogg Foundation and also will be recorded. This conversation offers a live Spanish, Vietnamese translation, and closed captioning, which you can access at the bottom of your screen. Use the Q&A to ask questions of our panelists and also use the chat box to add conversation. We really want you to be engaged and interact with us during this time. After the event, we'll email everyone a link to our website, IamNewOrleansStories.com, where we'll post a recording of today's conversation, additional resources, and a video that we're just gonna show you pretty soon. And most importantly, remember to join the conversation using socially hashtag I Am New Orleans. So get on that Twitter page, on that Instagram and Facebook, and use hashtag I Am New Orleans. I'd like to first introduce our panel and then share a video made by W.K. Kellogg Foundation, which will really help us really ground our conversation today so you can kind of see where we're gonna go from here. So without further ado, all of our amazing self-proclaimed lactivists, our first amazing panelist is Jade George.
Hi, everybody. I am Jade. I am a CLC with Nola Baby Cafe currently, as well as a doula. I will be an IBCLC by summer. I'm super excited about that process and this journey, and I'm happy to be here with you guys today.
Awesome. Thank you so much, Jade. Next, we have Lucia Jenkins.
Hi, everybody. Thank you very much for having me here today. I am an RN and an IBCLC, and I am the founder and executive director of Baby Cafe USA.
Thank you so much, Lucia. Next, we have Michelle Remy.
Hi, everybody. Thank you so much for having me. Michelle Remy, of course, is my name, and I'm an RN and IBCLC at Touro, and I'm an in-hospital lactation consultant, and I'm here for you guys with any questions y'all might have. Thank you.
Thank you so much, Michelle. And last but not least, we have Shanika Valcour-Leduff.
Hi, everyone. I'm Shanika. I am a family nurse practitioner, and I'm also the founder of Labor and Love. We do all sorts of support for moms throughout their entire motherhood journey, including breastfeeding support, which is so needed, especially in New Orleans. So I'm just really excited about this event to be here with everyone.
Thank you so much, Shanika. And so now we should be having our video play.
So one of the things that's key, living in a city that's mommy and baby friendly, that we have a body or a community of women that feel empowered about their bodies and that they are birthing in a space, in a community that actually welcomes their voice, that respects them regardless of their race. I would love to see policies and systems in place that embrace that as well, so that a woman doesn't have to fight so much for her rights in this community, that the community actually gets it.
Let's talk about the benefits to mom and baby.
We can go all day. We can go all day. That initial skin to skin helps moms bond. They have a appropriate parental attachment, the higher IQ scores, the less asthma, obesity, eczema. We can go all day.
And for mom, the long-term benefits of breastfeeding, like reduced risk of breast cancer. And then for families, like the cost of breast milk is free. And so breast milk actually helps the premature infant to actually be able to survive. In addition to the maternal mortality rates are higher, the infant mortality rates are higher in Louisiana as well, and especially for Black women. So breastfeeding is a protective factor for those babies that are really struggling in the hospital.
And you start to see an inverse relationship. Areas where they have high breastfeeding rates have low maternal and infant morbidity. So if we can narrow that gap, we can even that out.
Maternal mortality in the U.S. is, the rate is one of the highest in all developing countries. And sadly, it's actually on the rise, despite, decreases elsewhere. And this is really counterintuitive to advances in medical care, better access to prenatal care.
What we know about maternal health disparities that are happening right now is that women of color are dying at a rate that is 4 times greater than white women in this country. And that's the cause of negligence. It's the cause of implicit bias. I think what we're trying to do is change and shift the perspective of when that client walks into the hospital, what is the doctor seeing? Are they seeing a human who's scared and who needs their help, or are they seeing a demographic?
One big issue that I also, and we talk about this all the time, is that in some cultures, especially African American, you only go to doctor when you're pregnant. Like, you don't have a primary care doctor, you don't have an ENT, you don't have this and you don't have that. In Louisiana itself, we range between 48 and 49 in breastfeeding. Currently, the minority women, which is like African American, Asian, Spanish women, they are breastfeeding 3 times less than the majority. So their initiation rates are low and their continuation rates, like at 6 months and 1 year, are lower.
And the care that Black women get in New Orleans and elsewhere is likely very different. We all hold implicit biases, and there are movements locally and nationally to start to address this.
And so that's why Nola Baby Cafe was so imperative for our community, is because once the women left the hospitals, that was it.
This is something that we need to be doing. We need to be like holistically supportive of our women. We're not just answering to their desires, but we're also answering to their needs and to the needs of our children. So we should be coaching other dads like how to be supportive of their wife to breastfeed, because there's always seems to be some type of apprehension.
When a woman is breastfeeding, she needs the support of her husband. She needs the support of her family, her mom or the grandmother in the family. She needs the support of her employers in order to get through it.
Like, we need to see people who look like us and talk like us and who understand what's going on. I would like to create a paradigm shift in the thought process of how we feed our babies. Some moms are scared to breastfeed their babies. I want moms to feel like that they're the only person that can do that, and that's the best choice for their babies.
Thank you so much. I hope you guys truly enjoyed that informative video. It was beautifully made, and I think it really captures what we are going to be discussing on today. Before I jump into our amazing, diverse, and intelligent panelists, I want to share some important facts about breastfeeding. As someone who is super passionate about this field, I love everything that involves lactation with all that considers. We know that breastfeeding truly protects moms and babies from serious health issues, even long-term, as stated in the video. It is also best medicine for those preterm babies in helping them survive. And we know that those infant mortality rates are higher in New Orleans. And so the CDC, they say that only 66% of moms ever breastfeed, according to the CDC. And those numbers, they go down when we look at breastfeed babies exclusively over time. So we know that we, as lactation counselors and consultants, really have a pivotal role in our communities to really impact moms and babies and help them reach those breastfeeding goals. While the CDC reports that nationally Black and Hispanic babies are less likely to be breastfed than Asian and white babies, we don't really have specific data to each race here in New Orleans or in Louisiana. And that's a huge problem. And that's something we also have some work to do, really getting those numbers so that we know that we're really reaching out to the community, reaching out to those moms who are struggling or who may not understand what breastfeeding is and what that really looks like. So that's what the IBCLCs are here for, and the CLCs, to really be in the community helping those moms. Local, timely data by race are very critical to understanding the needs of mothers and families of color, and needed to create effective solutions. We need to create these solutions and have this data in order to be able to combat all of the barriers that these moms have to cross. We also know that 2/3 of moms don't breastfeed as long as intended because of a host of many reasons, including issues with lactation and latching, cultural norms, unsupportive hospital practices, unsupportive workplace policies. And that can be very difficult for moms. Sometimes they may not have seen it in their family, so that could be a barrier as well. And so lactation counselors or consultants, we can help moms see the vision prior to when they're pregnant. I call them little juicy treats. We can give them treats early on that they can put in their hearts early on about breastfeeding. That way, once they have their baby, they really know what to expect and how that looks, that a baby will feed on demand, the infant, or that skin-to-skin contact is so magical. I tell moms their skin is magical, that you can calm your baby, it'll help your babies, the milk produce, give out that oxytocin, that love hormone. It would improve that bond and attachment. And so really helping educating moms on how breastfeeding really looks and how it can be beneficial in their lives, and really just helping moms navigate through that. I know I've heard a lot of moms say, oh, I couldn't breastfeed, I wasn't producing enough milk, it hurt me, and all those things lactation counselors can help you overcome. Those are very small things that we can really help you. And so knowing that what we really bring to the table can really be beneficial for those moms who are kind of apprehensive and not really sure. You know, breast milk is live and active, and it's just so amazing to protect the baby and mom. And so really helping moms and families understand how imperative we are in the community. So I'm super duper excited about our panelists and our conversation with our experts. And I'm gonna first start with Michelle Remy, RN and IBCLC. And I have my first question for Michelle is, what are some ways we can improve breastfeeding rates as lactation professionals?
Thank you so much for that question. I think it's really important that we as IBCLCs support moms' decisions. And I think it does begin with a decision, right? So when you're pregnant, you have to decide, how am I going to feed this baby? And I think that decision needs to come with lots of education, and it does begin in pregnancy. So I know most of the local hospitals are baby friendly. And part of that baby-friendly 10 steps is to offer that education prenatally in the OB's office. And so there is kind of a guideline to where, you know, so many weeks you talk about this, and so many weeks you talk about that. And so you go over what it takes to breastfeed. A lot of moms, like you said, had never seen it. I myself had never seen it. I wasn't breastfed. I didn't have any peer people, you know, in my group that breastfed. So it's something that you have to sort of over time come to know, okay? And there's so many ways of doing that. And so we just need to see more education prenatally. And then of course, once they get into the hospital, that magical first hour is certainly the best, right? Even when you go in, you're thinking, oh, well, I may want to feed my baby this way or that way, or however you want to feed your baby, it doesn't matter. You do that skin to skin and you have that experience when that baby first comes out and oh my goodness, you know, and you feel that baby on you, you're like, oh my gosh, I'll do anything for this baby, right? And so all that comes to fruition when you have the baby and you have, I'm gonna cry, y'all, because it's such a beautiful experience. If you've never experienced it, you need to, you really do. So, and it also, you have to have the support, right? Not only from your people, but from your mother, your father, your partner, you know, you have to have that, because if you don't have that support, you know, it's a struggle. It really, really is. So we have to have that support for our partners, our family, and you know, and that sort of thing. So we do the magical first hour, we have that, and then we just need to just be there for our moms in the hospital for sure. We see our moms every day. Our lactation team is wonderful. We have great support there and we see them every day and we give them as much support as they need. And I like to say, I like to meet people where they are, because a lot of times, you know, they're not sure, they're on the fence, or they really can't make a total decision. And it is in the beginning, it's very, very challenging. And it does take time to kind of figure out what to do, how often to feed, how do I know my baby's being fed, you know, all those questions really, really do come up every day. But I guess lastly, we need to think about breastfeeding support, you know, outside of the hospital. And that's where baby cafes are so important because we have that as a backup, you know, and we also offer, at least at Touro, we have a warm line where you can call with any questions that you have when you get home. So hopefully we can cover you and educate you from pregnancy through delivery, through after delivery when you get home. And then when you get home and you don't have the support of the lactation team or the doctors or the nurses when you're in the hospital, that you can reach out when you do get home. Hopefully that answers that question.
Yes, Michelle, thank you. Yes, yes, definitely. And just to follow up with that, it's just so poignant, as you said, about that magical hour, that skin to skin, and really having that support when they get home. You know, once they leave the hospital, it's like, oh, I'm alone with this baby. I need help now. This baby is crying now. I need help now. So really knowing that the lactation consultants or counselors are there for you once you get home to navigate through that period. And also, I love that you mentioned as far as them getting help during the pregnancy, like I had mentioned before, which is so poignant because we feel that mothers receive that information better. It can be overwhelming once that baby is crying. At that point, you just want the baby to hush and be fed and be well. But when you are expecting and learning about these, it's more receptive and able to grasp it and really take on the key aspects of what breastfeeding really is and what that looks like. And so my next question for you, Michelle, is what is one piece of practical advice you would give to someone starting out on their journey to being an IBCLC?
I guess what the biggest advice I could give you is just make sure you're passionate about it, because, you know, if you're not, it's like, what's the point, you know, because it is, as a whole series here, what we're talking about today, it is a labor of love. And it really is something that you have to love to do, because it's a lot of hard work and dedication. If you're just starting out in your journey, I recommend that you go to a baby cafe, or, you know, you just shadow somebody at a hospital or wherever you can get in to sort of see what that all looks like. A lot of times moms that are breastfeeding themselves, you know, they will start their journey there, you know, because they enjoy it so much, you know, and they love it so much. So they want to share that knowledge. And I think that's a really great place to begin. As far as becoming an IBCLC, there are pathways for that. And so you can always look that up online, but it's hours and hours, thousands of hours of time put in with assisting moms in every environment possible, and educating their moms in any available outlet to do that. So I think that's where you would begin, of course, but something has to spark, you really have to have that initial, this is what I want to do for the rest of, with my career. And I think that's what happened with me. I had a wonderful lactation consultant when I was in the hospital. And luckily for me, I had the same person with all 3 children, which is amazing. It never happens, right? And so I stayed home with my children when they were born, but I, in the beginning, was a paralegal. So I had a total shift but when, I had my children and I enjoyed breastfeeding so much. And then when my youngest went to kindergarten, she went to school, I went to school, so I went to school as a 30-something-year-old wanting to educate myself and wanting to become an RN and not sure exactly, exactly where I wanted to be, but I knew I wanted to work with moms and babies. And so that's when, I started with that and realized that as a postpartum RN, I, wasn't able to focus on breastfeeding as much as I really, really wanted to. So that's when I started to focus really on becoming an IBCLC and started down that path. So hopefully that answers your question.
Yes, thank you so much, Michelle. It does answer my question. That was awesome. I feel so inspired just by listening to you to keep pushing and going for those dreams. I am super passionate about lactation. And so I think once you really know that passion, you really get excited about breast milk and learn what it really does is when you really know, okay, this is where I belong. Thank you so much, Michelle. Okay, awesome. We have next Lucia Jenkins, RN and IBCLC. And my first question for you, Lucia, what inspired you to create the Baby Cafe USA? And how can aspiring IBCLCs get involved to advance their career?
Well, thank you, Taeshaun, for asking. It was actually just an idea that came to me. I was a lactation consultant who worked in the hospital, and I have a private practice as well. I had 5 children who were fully breastfed, and somewhere in the arena of seeing what was going on, it occurred to me that the biggest gap that was missing was a place for women to leave the hospital and go right to immediately, easily to find where they could get expert care right away to fix any kind of issues that were happening. And I designed this model in 2004 just on an idea, and it was so successful that I took it on the road, and now we have 158 baby cafes in 34 states. The model is designed to be quick, easy, and inexpensive for communities to set up. And I designed it with standards that guarantee that when moms go there, they get a welcome, they get expert care, and they get their friends. It's in a relaxed, comfortable space, a welcoming space in a community. And the thing that's so important about reducing disparities is that this model had to be really inexpensive and able to be flexible to use whatever resources were available in the community. And one of my other requirements is that they utilize people in the community who are already there, who are breastfeeding experts and breastfeeding counselors, people of the same culture who live in that community, so that they can establish a continuity of care, of trusting care with people who they've known all the way from hospital doulas. And so it's in efforts to really create a breastfeeding wisdom that permeates the whole community so that mothers can just arrive with their problems and people are going to be there to welcome them and to say, oh, I think I see what's going on. And I think we can work on this. Baby cafes have to be open once a week so that mothers have a place where they can just come dependable. They all have digital scales, and they all have qualified staff who are there. We also have the second part of your question, we developed a mentoring program to be utilized in baby cafes. It takes about 2 years for somebody to attend a baby cafe, but they are mentored by the IBCLC to get a whole bunch of skills under their belt so that they themselves can hopefully become breastfeeding experts in their own community. My hope is that they then get hired to run baby cafes and work in hospitals to establish this wide range of help. And they're all free, and they aren't allowed to market or sell anything.
Yes, thank you so much, Lucia. I can definitely be a testament to those baby cafes, especially now during the pandemic of being on Zoom. The women, I think, became more vulnerable, and that mother-to-mother support is like no other. It's nice to have a practitioner on to make sure they're, passing on the right information, but that mother-to-mother support when they've been through it already is so beneficial to that other mom. It's really amazing. And so what you've created is an amazing space, and I'm super grateful for Baby Cafe. I actually did an internship there, and that's how I kind of got introduced. And so I was able to get a scholarship to get my CLC. So I'm super grateful for Baby Cafe, and I'm not even a pregnant mom. So pregnant moms, you have so much to gain from attending these awesome sessions. I'm actually going to skip around a little just to kind of spice it up a bit. I'm going to go next with Jade George. What barriers exist specifically for Black women and people of color when it comes to getting certified as a lactation practitioner? And how can we overcome these different hurdles?
Thank you so much, Tay, for asking this question. I genuinely feel, and I love that you followed me behind Lucia because Baby Cafe has been played such a pivotal part in my process and transition to where I am now. I feel like there are so many barriers financially, all of the programs and a lot of the education that's needed to become a lactation professional, you have to have the funding to pay for. So the mentorship program that was created by Lucia really, really helps with that because it's very, very low cost and the barrier to enter it is very minimal. But even from that point on, like once I become an IBCLC, I don't have an RN degree, right? So I still can't work in a hospital. That's a barrier because then all of these Black birthing moms or people of color who want and need to see someone who looks like them, help them and accessing them, there's a lack there. I feel like just seeing women breastfeed in general on a day-to-day basis, I myself did not experience anyone in person breastfeeding until I was about 26. So with that being the case, everything that I know and have been programmed to know about being fed is with bottles. And so these are small barriers and small things that we can really, really do to promote lactation professionals, really removing some of these things out of the way to allow accessibility across the board, finding more public breastfeeding places. I love when the breastfeeding sit-ins happen because then it's like you have no choice but to accept that this is the way that things go. And from there, right, you have little girls, little Black girls, little brown girls, the girls everywhere who can now know what breastfeeding is what we're supposed to do. And then from there, we know lactation professional is a career path. I had no idea growing up that when I was a little girl, I didn't want to be a lactation professional. I, like Michelle, completely pivoted out of my career as a human resources specialist for 5 years into lactation. But it felt so much more natural and like a calling for me to be able to go down this path. And it helped me so much to have a baby cafe that really was there to support in areas where I was not getting support. And I felt like the odd person out from breastfeeding my son in my community. So these barriers are definitely financial, accessibility. In order to become a lactation professional, a lot of these things you need the education for. As Michelle mentioned, for IBCLC, the pathways, you need college education credits in order to qualify to sit for the exam. You need 1,000 hours. If I am working a full-time job in order to pay my bills, how am I going to get these 1,000 hours? Really, really finding ways to empower and support people especially Black and brown women who really have this as a passion, and uplifting them in all of these ways, mentorship programs, scholarships, all of these things will really, really be beneficial to the lactation professional career path as a whole, the industry as a whole. I hope that answered, Jay.
Yes, thank you so much, Jade. Yes, I'm going to go to Shanika next. My first question for you is, what is the pivotal role lactation consultants can play in improving maternal and child health outcomes, specifically for Black, Indigenous, and people of color communities?
Okay, so the most important thing lactation counselors can do is to be present. We need to be visible in communities. We need to be accessible. I love that now breastfeeding is so publicized on social media, because more people are seeing the beauty of breastfeeding, not that it's this painful thing or this, this struggle, which sometimes it can be, but there are people available who can help you get over those hurdles. I think it's important to remember that not all communities have that generational history of breastfeeding. So when moms in Black and brown communities encounter these difficulties, they can't always go to sister or mom or grandma to see what they did, because generationally, not all of our families have breastfeeding experience, So it's important for us to be visible, be available to moms and families, to educate them, to support them, whether it's via Zoom or in person. I think it's really important just to be that hands-on support so that we can dispel a lot of myths that people have. I think the most important part of the role is just being there, being accessible, and having that visibility, especially in the community.
Yes, definitely. I totally agree. I think about as lactation professionals, we have the ability to truly advocate and really even put on campaigns to really make this very widely known and very imperative in the community. So we have a really big voice that we can really talk about in this industry. So my next question will go to Lucia. Where do you see the lactation industry going in the future?
That's such a good question. It's difficult to predict. Jade brought up something that is a real hurdle, is that many hospitals have guidelines where they will only hire an RN IBCLC. I live outside Boston, and I have a hospital here that I work in, and we actually have a non-RN IBCLC who, believe it or not, was one of my first baby cafe mothers who went on to become an IBCLC. So I think that, and she's fabulous, by the way, she's absolutely fabulous. And I think that we need to look very, very carefully at how we exclude women out of roles which they are fantastically suited for. And it's always bothered me that a woman in the community who's breastfed 4 or 5 kids, 3 kids, to an extended age, has a wealth of knowledge that is why the human species is on the planet. By the way, back many, many eons ago, we had the grandmothers and the aunties, and they solved the problems. And I think that as a profession, we have to be really, really careful about excluding the people who we desperately need to make cultural change. People have been talking for years about, we got to create cultural change. We've got to help Black and brown women breastfeed. Well, you do that by enabling these processes and these Black and brown women to share their wisdom. And it's frustration for me from where I sit. And that's why I'm trying to do what I can. Every mother deserves help feeding their child in the way they've been told. And one thing I didn't mention before, we do collect data at baby cafes. They are required to collect data. Taeshaun, you brought up such a very important, people will not invest in programs unless you collect data. And our outcome data says that moms attending baby cafes 5 or more times are much more likely to breastfeed for a year. So we have to make the baby cafes so that moms can get there.
Yes, we have a question from the chat box, and it says, how can a non-RN LC get into the hospital?
Well, you have to look around for a hospital, beat on doors. And in our case, my IBCLC, she had an advocate in me who I'd worked with, and I don't know of any professional arenas yet. I'm working really hard to try and create spaces for women to get training and mentor. The same thing, hospitals don't allow people off the street to just come in and play with their mothers and babies. So most hospitals don't offer mentorships either. And it shouldn't be that exclusive.
Yes, I totally agree, because that support is really needed once moms leave. So I totally agree with you, Lucia. Thank you so much for that. I'm going to go to my next one for Jay George. My question for you is, what was your first win that made you confident that you were doing the right thing?
Thank you for this question, Tay. So I have to say that my first win with lactation in general has to start with breastfeeding my son myself. I feel like that was my first rebellion in a sense, and it shouldn't be a rebellion, right? It should just be a choice. But in my community, it was an absolute rebellion. I fed him for about 4 years, and that was absolutely the first win. I think professionally, to really know I was doing the right thing was really being able to help parents and educate parents in ways of support. What this support looks like, coming from grandmothers to mothers, or coming from dads to moms, not just parents, mothers to mothers, parents as a whole, right? Really, really finding ways to provide a space and a ground for support and connectedness. Having someone who's been struggling to feed their babies is really like the worst imaginable fear, not being able to feed your baby. So having someone come into a space with you and be so vulnerable and intimate to allow you to assist them with something that they care so much about, their baby, and giving you that level of intimacy is the best word I can use for it. And then helping and guiding and assisting and teaching, right? Not just doing it for them, but really teaching them how, when I'm no longer around anymore, you can still get your baby to the breast if that's your goal. And when the baby gets on and it's been painful before and they're doing it now, and the mom's face is like expecting pain, but feels that relief that comes because the pain is no longer there, is magical. I've literally cried tears in clinic because of this magical moment where, you know, they've been trying and it's been struggling, and if they've, but never given up, really knowing, okay, you know what, I need some support. There's nothing else that we go to and expect to do and get right the first time, right? We don't get on a bike and we're like, oh, we're going to get this bike ride right the minute I get on it. I've never rode a bike before, but I'm going to ride this bike perfect this time. No, it's something that we learn. It's a skill set. And so really knowing, okay, I could use a little bit of support, allowing yourself to get that support. And then from there, being in the room when those magical connecting moments happen is absolutely a win for me. And that from that point on, I know that is my absolute purpose and passion to have many, many of those moments forever, and to help and empower others to have those moments, whether it's grandparents that are supporting that they're living with, or parents, or other lactation professionals who I can empower and support to create more moments like those.
Thank you so much, Jade. That was very inspiring. Once makes me want to cry as well. We actually have another question in the chat box for you, Lucia. You're a popular lady. So this one says, I'm so thankful to those of you who have stood through, oh no, I'm sorry, that was the wrong one. Excuse me, I went up too quickly. I am an LC of color in Louisiana who has knocked on many doors, and due to policies and procedures in place, all doors have been closed. How has having a non-RNLC helped at your hospital, Ms. Lucia?
Well, thank you for that question. First of all, our non-RN IBCLC does, after orientation, she rounds on patients on the floor. And she also has been instrumental in our outpatient program. So we have an outpatient program where people can make an appointment and come in one-on-one with an IBCLC. She does that a lot. She's flexible. She has young kids, so she can come in for that portion of time. In addition, she runs the baby cafes on alternate weeks that I do. And we've been able to demonstrate by having her at the hospital, the nurses adore her. She knows breastfeeding inside and out. And those are the specifics really required. So what I would suggest to people is to contact the lactation department and maybe start by offering to run an outpatient support group. I think that might be a good way to start. A lot of hospitals do sponsor baby cafes, and it's a good way. They don't have to pay the high fees that an RN gets paid. They're on scales at hospitals where the more hours you work there, you get more and more pay, but you can pay an IBCLC non-RN a little bit less and still run a crackerjack program with incredibly good breastfeeding care.
Thank you so much, Lucia. Yes, that was awesome information. I truly appreciate that one for sure. I have my next question for Shanika. What inspired you to get into the field, and what piece of advice would you have for individuals interested in making a substantial difference in infant and maternal mortality?
Thanks, Taeshaun. So what inspired me to get into the field? So I guess I have always been the baby lady. I've always had an interest and a love for babies and birth and, all that good stuff. And it's funny because today, I think it's actually today, but it marks 10 years that I've been doing birth work. So I started this journey a while ago as a nurse, and what really got me deeply involved in birth work and wanting to do more than my in-hospital job was my experience. So when I got pregnant, anyone who's watching or y'all on the panel who know me, y'all know how rough my pregnancy was. My breastfeeding experience, my postpartum experience, everything was just a lot harder than I expected it to be, especially seeing as though I was the woman who helped everyone else do these things. And so I thought to myself, okay, if I'm having this much difficulty and this is what I do for a living, what do all other women need? What needs are there out there for women who don't have this knowledge and training and expertise in this field? And so I really just wanted to take my passion and try to ease a lot of those hardships for those women and their families by educating, supporting, and just really being out there. And so my advice would be to anyone who is passionate and has a love for birth work or for lactation, the lactation industry, because I love that term. Just do it. I mean, I know there are barriers. The barriers can't be broken down until we break them. So we just have to keep pushing and keep doing things to get these resources that are so needed out there in communities and for women and families who will benefit. The more we do the work, the more we can decrease morbidities in certain communities. And once we enhance the health of communities, the world would be a lot better.
Thank you so much, Shanika. That was so well said, so true. Being so there for those moms and the community can be so beneficial for them. We also have another question in the chat box, and we can see when I say the question, if you feel like you can answer that best, you can unmute yourself and say your answer. The question is, what policy efforts are being done in New Orleans and Louisiana to help traditional low-income people of color, employers assist in promoting breastfeeding? I can read that again if you need me to. What policy efforts are being done in New Orleans and Louisiana to help traditional low-income people of color, employers, assist in promoting those breastfeeding rates? Anyone think they might be able to take a stab at that one?
I can give it a shot. I don't know that I'll like ace this question, but no question left behind. So let's try. So I currently feel like the laws that are in place, especially the Louisiana laws around breastfeeding, are there to support breastfeeding and pumping parents that go back to work. Are they enforced and followed? I guess would more so be the question. I think that really empowering the parents who are going back to work to know these laws and allow themselves to feel comfortable to show the law. Hey, you know what? I get this many pump breaks. These are the areas that I need to be able to pump, and really doing so either during pregnancy or before you go back off of leave, to make sure that when you get back, these things are hashed out, not waiting until you're already back from leave. Having these conversations with management ahead of time. And so one of the resources hopefully we'll be able to provide, or you can look up, are the Louisiana laws around breastfeeding. There are Louisiana laws around breastfeeding. And regardless of where, by law, you are provided a place to pump and or breastfeed, but most likely pump, saying that your baby probably won't be with you. And you get a designated break. There should be a sink. And this is also separate from, as Shanika said in the chat, separate from your lunch break. You get pump breaks, and I like to compare it to smoke breaks, right? We give people who smoke many, many smoke breaks because this is what people do. We pump. We have to feed our babies. We have to empty our breasts. Otherwise, it impacts the future of my baby's nutrition and food. It's non-negotiable. And so really empowering ourselves and connecting to your local community places if you need some support in that area, right? So finding ways to bring up these conversations, and if they are not being responded to properly, going to EEOC or coming to a baby cafe or any of your local community groups that will happily stand behind. Call me. I will happily stand behind you to speak with your employer about allowing accessible by law places for you to pump. But really, really knowing what these laws are and being able to have these conversations around them. That's all I had. Sorry if I didn't answer the whole question.
I think that was awesomely said, like saying as like, you can call me. As far as a professional lactation counselors and consultants, we have a voice as well. We can advocate for you. That's our job. That's an oath that we've taken with our certification. So we are dedicated to helping you navigate through this journey. So if you're having those barriers, we are here to help you cross those barriers. So I love that. That was an awesome answer. I have another question from the chat. It says, what's available for Latinas and other communities who don't speak English or have other cultural barriers? That's a great question. Is anyone familiar with any particular organizations here in the city?
I don't know anything about New Orleans and what's available in New Orleans, but one of the things that we talk about when we're helping communities set up baby cafes is to look at the demographics in their community and find people who speak that language who are major breastfeeding advocates. They might not be IBCLCs, but they're there to begin to, they often arrive as a volunteer and they become really wise about breastfeeding. They might be a Hispanic mom who breastfed 3 or 4 kids. And if the facilitator of the baby cafe reaches out and engages her to come and be part of this conversation, it helps. We have one of the baby cafes is in a refugee center, and they have a CLC there who speaks 5 different African languages. And there's another one that speaks Nepalese. So they run specific groups that are just in that language.
Wow, great to know. So definitely we know that we have some work to do in the city of New Orleans, making sure. Oh yeah, go ahead, Jade, I'm sorry.
No, Tay, I'm sorry. I just didn't want to move off from the topic. So I know 2 things are also that locally in New Orleans that are going on. I know that Baby Cafe is in the process of training one of a mentor who speaks Spanish, and New Orleans Baby Cafe is in the process of training her. And then I also know that one of the local community programs, Cafe Ole, has a Spanish speaking meetup called Cafe Con Leche. And I see some people talking about it in the chat. So I'm not sure if y'all can see those in the chat. So New Orleans is definitely in the process of expanding the Hispanic community and specifically for Spanish speaking women, because we know that you guys are there and need the support too. And we don't want that to be a barrier for you all as well.
Yes, thank you so much. We're getting so many awesome feedback from the chat about what's going on in the community. So this also helps us. That's why Jade and I are very passionate about getting IBCLCs and CLCs of color to come together so that we can know more what's going on in the community, to see how we can really better help these moms get over these barriers. So I have one more question. How do we balance reducing the cost barrier to women that need support with paying IBCLCs and lactation consultants and counselors, and making sure they're getting their worth and can make a living? I think this is a great question. Anyone willing to take a stab at it?
I can take a little bit of a stab at it, just because of my experience with helping communities set up cafes. And I do require that there be funding available for 2 years to fund the baby cafe once it gets started up and running. And we suggest all kinds of different ways to get the money. The community is responsible for paying the staff of the baby cafe to run it. And I recommend that they pay whatever the going rate is for that person's status, whether they be a CLC, a WIC peer counselor, or an IBCLC. And when they're serious about wanting to offer a breastfeeding support group in the community, which gives them a lot of, oh, look what we did, it's really great. I keep reiterating, it's very, very important that these people get paid, and that they get paid well enough. If they're collecting data, they should be paid an extra hour beyond the 2 hours for other work that they do. It's not fair to offer these programs and hire people and underpay them. So I do what I can from my end. It's still not good enough. I've run across baby cafes even now that somehow get money to get started, and I find out a year later that the people stayed on to work with no pay because they love what they're doing. But when the funding ran out, the first thing they do is just stop paying the people who work. It's a tragedy. It's just not necessary. They should move their money around and make sure people get paid.
Definitely. I think you did a great job at stabbing at that question, Lucia, for sure. Also, I want to make sure you guys know we put it in the chat box about more information about the Spanish Leche League. And it also has some information on how you can contact them. So I think today was so amazing, so informational. And And I just was so happy to be here today. I just want to say thank you to all of our amazing diverse panelists for their insight and their expertise during this journey. And I also want to remind everyone to visit IamNewOrleansVoices.com, where you'll find this video, a recording of today's conversation, and additional resources. The video that we showed earlier will be on the website. And also, just to let you know, registration is also open for our next event in the conversation series, which is Early Learning Teachers, a bridge to a better future. We want you to join us on April 7th as we discuss the importance and the impact of early learning teachers. And lastly, I would not want to forget to add to the conversation socially, please, using the hashtag #IamNewOrleans. And I'm just so happy that everyone was able to join us. I hope that this was very informational and beneficial for you. And we thank you guys.